Well, this conference is very interesting because it's something that now are achieving the new treatment for cancer. And proton therapy is some of the last treatments. It's very old, but the information that we have in our hands for the last studies are very promising, especially because the technology is more simpler and it's more feasible to use it. And we were discussing, as happened some months ago in Prague, in Peacock, what is the situation of proton therapy at the present time. Yeah, it's very interesting because to see the different program of proton therapy units, because they start also in the States. The Procure program, more than 10 years ago, they tried to develop 10 centers for proton therapy, and they fail. The majority, not all, but the majority they fail because they have not made the good calculation of the investor. And that reason means that the technology goes very slowly and the price of the technology is very high. And that's happened also in Europe, because there are some projects that's happened in Germany that they tried to develop a huge program, and although he succeeds with in 1 or 2 centers. In Switzerland, they have a large program in all the cantons to put at around 10 proton units, but they fail and only have 1 in Zurich. And that is something they have to learn about that, because in Spain also it's happened the same that in UK, that we have no proton therapy unit, and now we're trying to develop some of them in our center. They have the most advanced project to install a proton therapy unit in Marbella. And the proton therapy today, this delay is very helpful for the success of the project. Why? Because the delay means that you are having and you're receiving new technologies, simpler technology in small space, and also much cheaper. Today, I could tell you that probably the inversor of proton therapy is half of 5 years ago. And that means that it's more affordable for a lot of hospitals. In our case, we are focused in one small compact unit, one room, that you have to have enough patient to cover. They take the recovery of the inversor is very hard. It takes some time, but we make our calculation. We hope that we could succeed in a short period of time. This history I know very well because I participated in that history, because the guy, this Ashya King, came after finishing the proton therapy in Prague. They came to our hearing to recover and to make all the rehabilitation during 3 months. And it was a very risky decision because the tumor, the posterior fossa, is a very aggressive tumor and need to be complemented after surgery with chemotherapy and radiation, standard radiotherapy, who produce a lot of side effects and long-term problems. The father of the child decided not to stand their way, and they take the risk to do it only with proton therapy, and they succeed because it was more than 2 years and a half. And now the child is absolutely close to be fully recovered. He's walking, speaking, and going to the school. No? This was one example, but this created a situation in UK because you know that some years ago there was approved some budget for develop proton unit, and the budget was moved to other priorities. And now after this history, they are running some 5 or 6, I don't know how many center, one of NHS, some other private, and well, they have a calendar that will come in the next coming years. And I hope that it will succeed, because at the present time, all the British candidates are a lot. As soon as happened in Spain, they have to send it far away, no? Yeah, this is a very exciting new field, as I mentioned, because there are very few medical oncologists involved in this situation, because we are very, a medical oncologist wants to to go immediately to the new treatment. And for us, when I was involved in the proton therapy development, for me was like a new drug, because it's a new drug, but it's a curative drug. And I was very happy to see the name of several medical oncologists like Professor McPhee involved in the project of proton therapy, because our view of the treatment of cancer is a little bit different from other specialists. And also we learn from a new specialty. I just checked a new area of the physics. Physicists are the most important specialists in proton therapy development, because they make the calculation, they make all the procedure to put all this beam in the proper place, and this takes a long period of time, a very complicated procedure, and these are essential for having a successful treatment. My conclusion is that I'm very happy to hear that there's a lot of people with interest in proton therapy. I know they still have something against that, because also under the medical economical point of view, that is, they say the proton therapy, somebody said yesterday, I think it's Carlos Sikora, said the proton therapy is the most expensive medical device today. But it's true. But if you compare with other cancer treatment that is more expensive, that you are using as a chemotherapy, the new agent, and all the immunotherapy, that is, we could compare. And proton therapy has a lot of future for I'm convinced that in less than 10 years we will replace totally the standard radiotherapy with photon.